Hello everyone. Today we have Dr. Manindra Barman who got a good rank in both UPSC CMS and NEET PG and currently he is doing MD Pediatrics from ICH Kolkata. First of all, many congratulations to Dr. Moninder. Please tell about yourself and your journey.
Thank you, ma'am. First of all, ma'am, thank you for giving me opportunity to talk in this platform. I am Dr. Manindra Barman. I recently got selected in UPSC CMS exam 2025 in Railway Cadre, and I am currently pursuing my MD Pediatrics in ICH Kolkata, and I have done my MBBS in Medical College Kolkata, and really thankful for, to you to giving me opportunity to talk in this platform.
When did you first come to know about UPSC CMS and when did you start your preparation?
Actually, ma'am, I got to know about the exam in the meet of the internship. During my internship, one of my friend got selected in UPSC CGHS. So she told me about the exam. Then I started to find the details of the exam pattern, how many questions are there, and what to read. And since then, I was searching for resources, what to read, and I was really confused to find the resources initially. Uh, so in the middle of the internship, I got to know about the exam, and so I got very less time to prepare for the exam.
You secured a good rank in both UPSC CMS and NEET PG with your internship. Could you please share your preparation strategy and how you manage both exams during your internship?
Actually, ma'am, I have just passed the final year exam, and I was in the internship. So I've just completed my final year exams, all the subjects thoroughly, and I have also practiced some MCQs on those subjects. So final year subjects are almost done. But I have started to forget the first year and second year subjects. So it was very problematic initially in the starting of the internship. So I decided to first finish the first year and second year subject and do all the MCQs of those subjects, so that I can get some grip in the all the subjects in the in MBBS. So initially, I started with first year and second year subjects, and I've just read the final year subjects. So all that accumulated as a first 6 months, I have accumulated all the resources and started and finished first reading. And after that, I have came to know about the UPSC CMS exam, and then I started preparing for that initial phase of preparation, it was hard for me to just directly start from UPSC CMS because I was not finding any resource. It was really difficult for me.
Which book or resources did you use for your preparation?
Actually, ma'am, then I started finding the resources, and I came to know about the Prasad Guide, and there I found that there all the previous year papers and explanations were given on those books, and the explanation that is given, that is from standard textbook. So it was really helpful for me. I really suggest these books for all the juniors who are going to pursue or want to take that exam in the recent years. Uh, my problem got solved after I came to know about this book, and I've ordered the book within a week after I came to know.
Some students prefer studying a topic first, then solving previous year questions, while others start with the previous year question and study the related topic afterward. आपने कौन सी स्ट्रेटजी फॉलो की थी?
मैम मेरा फर्स्ट 4 to 5 month I have read the content once, whichever app or whichever things I have read in the MBBS, I have completed it in the first 4 to 5 months once, and after that I have started practicing MCQ from every platform and every book. And I have found the UPSC CMS Prasad Guide book, that was every previous year's questions were nicely explained. So I started reading those explanations. Like in other apps, so many people use other apps also. They used to read those explanations part. I also read those explanation part in the UPSC CMS Prasad guidebook. It was really helpful for UPSC CMS exam also and NEET PG exam also. So it also helped me in the NEET PG rank also. So previous year exam papers is really important to practice for any exam we are going to take in the future or as a aspirant, be it NEET PG, be it INI-CET or UPSC CMS. Previous year's paper will be always helpful and important.
Preparing during internship is really difficult. आपकी ओपिनियन में
Yes, ma'am.
मिनिमम कितने साल के प्रीवियस ईयर क्वेश्चंस को करना चाहिए?
एक्चुअली ऐसा कोई कट ऑफ ईयर नहीं है. आप जितना कर सकेंगे उतना अच्छा है, क्योंकि यूपीएससी सीएमएस में एक ट्रेंड है कि बहुत पुराना पेपर से भी क्वेश्चन रिपीट होता है. तो ऐसा कट ऑफ नहीं है. अगर नहीं कर सकेंगे तो as much as you can, that is the suggestion. At least 5 to 10 years you must do for next juniors who are going to take that exam. And it is nicely explained in the Prasad guidebook.
प्रसाद गाइड के बारे में आपको सबसे अच्छी बात क्या लगी?
हाँ मैम, प्रसाद गाइड बुक में जो क्वेश्चन रिपीट हुआ है वो मेंशन किया हुआ था. कितना बार रिपीट हुआ है, कितना कितना साल में रिपीट हुआ है. सो इट वाज वेरी ऑब्वियस फ्रॉम दैट part that which questions are most important, and we also get to know the explanations which the next question can be framed. So it is really helpful for upcoming juniors to read the Prasad guide to get selected in the exam.
आपका इंटरव्यू का एक्सपीरियंस कैसा था?
It was one of the best interview of my life. The panel that took my interview was really knowledgeable and helpful. First, they make me calm and make me drink water and make me comfortable, and then they started asking questions. And most of the questions were from mainly management of the general emergencies that we faced during the internship. And another part was that they asked question from the PSM part, all the central government schemes that is going on, and about those obscene emergencies and obscene patient, how to counsel the patient. That part they asked mainly. They mainly asked the practical aspects of being a doctor and how we manage the emergencies during internship. For that only.
तो इंटरव्यू के लिए आपने कोई स्पेशल प्रिपरेशन की थी?
Actually, ma'am, I have read those general emergency parts, how to manage decay, how to manage, how to correct the electrolytes imbalance, how to manage the respiratory distress patients, and for obscene emergencies, and how the central government schemes. I wrote those things only, and other things they can ask. Actually, they can ask anything. So all things we could not. Actually cannot cover everything. We just have a brief to our the practice and the general emergency part that we do our in internship.
प्रिपरेशन के दौरान सबसे बड़ा चैलेंज क्या था आपके लिए?
Actually, ma'am, the main challenge was that I was not getting enough time to study. I was in the internship, so in the admission day or in the other hectic days, I was not getting time to study. So जब भी मुझे टाइम मिल रहा था तब मैं वो कवर करने की ट्राई कर रहा था अभी कंटिन्यूअस रखने के लिए. Otherwise, in admission day, we got 24 hours, even 36-hour duty also. So it became very hectic and very hard to complete and continue the study during preparation. And another thing, during the end times of the preparation, in the last few months, actually we started self-doubting ourselves that can we make the exam or not. But after exam, we realized that it is not the thing. Just we have to just continue studying and not thinking about all the things.
क्या ऐसे मोमेंट्स भी आए जब आपको लगा कि प्रिपरेशन टफ हो रही है, तब आपने अपना मोटिवेशन कैसे मेंटेन किया?
moment during last few months, 2 to 3 months, actually I thought about that quitting the preparation and prepare for the next year, because in internship that was very hard for me to give my full potential into the preparation. So in last few months I actually doubt myself, so I can clear the exam or not. But our NEET exam also got postponed. So again, we get energy to for the I think for the freshers who have just completed the internship and gave the exam in the running year. That is a big boost for us. That NEET exam got postponed. So we again started preparing in the full force.
आप हमारे सीएमएस एस्पिरेंट्स के लिए क्या क्या एडवाइस देना चाहेंगे ताकि वो नीट भी क्वालिफाई कर सकें और सीएमएस में भी उनका सिलेक्शन हो सके?
Yes, ma'am. The main problem is that we often used to focus in one exam, but thing is that the topics that are for CMS, INICT, and UPSC CMS topics are almost same, and in UPSC CMS, few topics are asked repeatedly. So first of all, we have to just cover that whichever resource we have already read in our MBBS time, once, twice, or thrice, and then start solving MCQs for NEET also and UPSC CMS also. For Prasad Guide, if you solve the previous year's questions and add our the explanation part in our notes and revise again and again, uh, we can crack the both the exams, UPSC CMS and NEET. So advice for the juniors is that don't lose hope, keep studying for both of the exams, solve previous year's papers for both the exams, and start it add on in your notes so that you can revise in the last few weeks and months of your exam, so you will crack both the exams.
अकॉर्डिंग टू यू कॉमन मिस्टेक्स क्या हैं जो एस्पिरेंट्स को अवॉइड करनी चाहिए?
uh, the one of the most common mistake is that self doubt, because we started thinking that we are not able to do good in the exam, or not able to clear the exam this year. So we started thinking about the next year. We have to avoid that thing. Another thing that we used to follow the multiple resources. So one thing that we have to fix our resource and add on the material on that, so that revision become easier. If I prepare for UPSC CMS and I'm studying also for the NICT, I will follow the one resource. And even for the UPSC CMS, we have to follow the one resource only. For me, that was the Prasad guide. I follow one resource only, and I read those explanation part, and I extracted the gist part from the explanation, and I've added those in my main notes. So it become very helpful for me. It will be helpful for my juniors also who are going to take the exam in recent years.
लास्ट में सीएमएस एस्पिरेंट्स को क्या मैसेज देना चाहेंगे आप?
CMS is a slightly different question pattern than NEET. So preparing for CMS will be a great choice nowadays, because for NEET also we prepare for the MD examinations, and the CMS is a government job actually. For those who prefer government jobs and want to settle early in the life, that will be very helpful for those to prepare for CMS. And also we can take both the exam and then decide what to do in, because most of us don't know what to do in after the MBBS. So we should take both the exams.
आपका नीट पीजी और यूपीएससी दोनों में सिलेक्शन हुआ है, ठीक है, आपने पीजी ज्वाइन किया।
Okay.
आपको क्या दोनों में क्या बेनिफिट लगते हैं कि क्या ज्वाइन करना चाहिए, कैसे सिलेक्शन मतलब हमें डिसाइड करना चाहिए कि हमें पीजी करना है कि सीएमएस करना?
मैम मुझे तो ये लगा कि वो इंडिविजुअल के ऊपर डिपेंड करेगा कि फैमिली का कंडीशन कैसा है, अभी इकोनॉमिक सपोर्ट देने की जरूरत है कि नहीं फैमिली को। तो अगर ऐसा है कि फैमिली को इकोनॉमिक सपोर्ट देना जरूरी है अभी, और एक स्टेबल लाइफस्टाइल भी हमें चाहिए, वो एक इंडिविजुअल के एस्पिरेशन के ऊपर डिपेंड करता है। फ्यूचर में क्या करना चाहते हैं. इवन इन द यूपीएससी सीएमएस वी कैन आल्सो डू डीएनबी एमडी. But for my case, I was doing internship and then got selected in the PG. So I thought about finishing my PG at the go, at once. So and I also thought about the extension of my UPSC if it's possible. So then after completing PG, I will join the UPSC.
थैंक यू सो मच डॉक्टर मोनिंदर, आपने इतना वैल्यूबल टिप्स और अपनी इंसाइट शेयर की.
Thank you, ma'am. Thank you, ma'am. Thank you for giving me opportunity.